Welcome, everybody. It's my favorite rendition of Baby Shark. If you can have a favorite rendition of Baby Shark. At the end there, it slowed down a little bit, so I hope that is not a sign that the weather is affecting internet connection. But welcome, welcome, welcome. Some of you had your history visits yesterday, the day before. Some of you I will be meeting with tomorrow for your history visit. So you should be able to see my host screen very shortly. I'm giving you just a few moments to grab your pencil and paper and your notepads and whatever else you need um, to take notes. Notes. This is Full Circle Women's Care Pregnancy Orientation. And I had an echo there for a second. If you're able to hear me without an echo, raise your hand. And if so, I will proceed. Okay, cool. All right, let's move on. Full speed ahead. All right. So some housekeeping things first. First of all, this is confidential. No one will be able to see who you are in terms of the questions that you ask or that you're on the call. I will get a report later of who attended, but no one else will know you were here. So feel free to ask me questions. Please participate, answer the poll questions, because those are my ways of checking to make sure that I am relaying the message, and it also helps me to kind of guide what I say next. And then if you have to jump off, I know we're getting close to dinner time for some of you. This entire presentation will be available on our YouTube channel afterward. So we'll start with a poll question right now. Let me know who's on the line. This will again help me guide how much I go into the weeds on this. How many first-time mamas do I have on here, and how many veteran moms do I have? So this is kind of how it will look. The poll questions will come up. I'll talk for a couple of seconds, and then I'll say the polls are closing in 3, 2, 1, boom. Polls are closed. And it looks like the first time mommies, we have a few more than the veteran moms this time, and perhaps a few spouses or partners or significant others on the line as well. All right, so things we're going to cover today include the full circle experience, which includes where we deliver. We'll go over some of our office protocols, like how to reach us, what to expect at your pregnancy visits. I'm going to give you lots of prenatal resources, answer a bunch of questions about exercise and nutrition in pregnancy, and we'll wrap with a quick COVID-19 update. So we're going to start with our practice philosophy, which is that pregnancy and birth are normal life processes, not a disease of which we must cure you. This is a physiologic experience. It can have some complications, though. The traditional midwifery model cared for normal, low risk women. But if it identified any abnormalities in the pregnancy or certain abnormalities in the pregnancy, they had to transfer out to get a different acuity of care. In the collaborative model where physicians and midwives are in the same group, you stay under the midwife care with physician direction. So to that end, the majority of our labors and deliveries are attended by our certified nurse midwives. So I know some of you started out as my GYN patients, Dr. Marrow, Dr. Mooney's GYN patients. You're like, oh, I'll just transfer over and then Dr. So-and-so will deliver my baby. Maybe, but most likely one of the midwives will be in attendance at your delivery. Now, obviously, there are some things that are outside of their scope, and if those things come up, then they call an OB consultation, so to speak, phone a friend. If it's something urgent, meaning like we need you now, but not right now. So you have the 15 minutes it takes for any of us to get from our house to the hospital. One of the full circle OBGYNs is always backing up the midwives. If it's something emergent, like you don't have 15 minutes, our hospital of delivery is staffed 24 hours a day with OB hospitalists, board certified OBGYNs who are in-house for true emergencies. And true emergencies don't happen as often as social media would have you think they do. For example, in 2022, we used them twice out of 540 deliveries. And the most common reason we use them is somebody comes in 10 centimeters and neither the midwife nor the doctor is there and somebody has to deliver the baby. But if it is like a C-section situation, and usually by the time you're back in the operating room and or the baby is delivering, your one of your doctors is coming in to assist and finish up. So where do we deliver? That's a great question. Our current facility is HCA Florida Hospital. It's on University Boulevard, not too far from our office. They are having tours. So they have a couple of different options for tours. So there are group tours. They call them their stork tours. Once a quarter, they host. It's like a baby shower, and they raffle out prizes. There's food. It's really cute. But you can also tour the unit, get to meet the nursing director and nursing staff, and get to see where you're going to welcome your little one or little ones. If those times don't line up with your schedule, there's a phone number we can give you, and you can call them to schedule one-on-one tours. They do those during the day, they do them in the evenings, they do them on the weekends. So whatever is convenient for you, they want you to see their newly renovated facility because it actually is really nice over there. All right. HCA is, as I mentioned, if it's been our facility since October of 2023. And if you delivered with us before at Ascension and have questions about why we moved, we're going to show you where to find more answers on that very soon. All right, how to contact us. So our office hours are from Monday through Thursday from 9 to 1. We then close for lunch from 1 to 2, and then we open back up from 2 to 5. On Friday, we close at 1 p.m. So if you're calling with an issue between 1 and 2, Monday through Thursday, you're going to get the after hours line. And the reason you get that is because it rolls over and connects directly to our emergency on-call provider. So if you're having an emergency during lunchtime, then you can still talk to the on-call provider. If it's not an emergency, you're like, oh, I think I'm going to be late to my appointment at 2, or I need to cancel or schedule, or I need paperwork or labs or something, call back after 2 so you can reach a live person. If it's Friday and 12:50 and you're calling and you left a message and you're not getting a call back, but it is something clinically that you'd like a call back for, you need to call back to get the on-call person. Or if you do leave a message, just know administrative stuff will be answered on our next business day, which is usually Monday, unless it's a holiday. All right. Next, appointments. So we do not have any walk-in appointments because our goal is to see you as close to your scheduled appointment time as possible. So if we promise you the 10 o'clock slot and someone else decides at 9:40, I need to go see my doctor, and they walk in at the 10 o'clock slot, they can't have your slot. It was promised to you. And so to that end, we have some limited same day appointments. You know, people deliver, they fall off the schedule, people cancel all the time. So if you are walking in and you say, you know, I'll sit, I'll wait, the front desk will look at the calendar and tell you, okay, there's an opening at this time. We can put you in here. Definitely call rather than walk in, because it's pretty rare that you'll walk in at exactly the time somebody else canceled. But if you're calling and you're saying, hey, I need to be seen today, we look at our schedule, there are no places to work you in. We may suggest that you're either seen at urgent care with your primary or at the hospital. And it's not us saying we don't want to see you. It's us saying we agree you need to be seen, but you should not come and sit in our lobby for 3 hours waiting to get worked in on our schedule. So they recommend an outside setting. Please know that it's us just trying to make sure that you're getting seen as soon as possible. Next. Oops, sorry, you're probably seeing this faster than I am. All right, so phone calls, if you do call in, providers are not able to leave appointments to take phone calls. Again, if we promised you the 10 o'clock slot, you have our undivided attention during your appointment time. And so we ask that you respect other people's appointment times as well. We do have a nurse who takes triage calls. So if there is something clinical, you can leave a message and she can call you back, or, you know, can speak directly with her. There's, you know, certain things that she's able to triage her way through. If it's something that's outside of her scope, she knows how to get in touch with the on-call provider in order to ask any questions and get back to you in a timely fashion. But you do have to leave a message for us to call you back. Some people call and hang up and call and hang up and call and hang up. But we won't know that you called unless you leave a message. And when you leave it, please be sure that you are leaving it with the right person. So the nurse that we have who's on staff to take messages is Tony. She's also the person who does FMLA paperwork. And I think you guys can see the slide. FMLA paperwork and disability paperwork as well. Naisha is our OB coordinator. Many of you have interacted with her already. She's the one who sends out your labs and blood work initially. And if you need referrals, like to high risk or to the cardiologist or hematologist, what have you, or if at the end you need your delivery scheduled, she's the one who takes care of that for you. You've all met Renee Hall, our benefits coordinator. And if something changes with your insurance, or you don't understand why, you know, you've met your deductible and you're still collecting on something, please please don't hesitate to reach out to Renee, especially if something changes with your insurance, because we don't want to still be collecting on an old plan or have you get a huge surprise bill because we weren't collecting all along. All right. So when you press buttons to leave messages, it's going to go to that person. So please be sure that it's the right place. So please don't tell our biller about your mucus plug because it freaks him out. There's always somebody on call for our practice every day, all day. After hours, we have an emergency on call provider. So this is for if you think you need to go to the hospital. So there is you just call this the main number. You'll get the prompts, follow them to reach the on-call person. But again, you have to leave a voicemail for us to give you a call back. It doesn't even register that a call came through unless a message comes through with it, please. And follow the instructions on the message so we know how to get back in touch with you. All right. The other way to contact us is patient portal, but remember the patient portal response times can take up to 2 business days. 2 business days. We don't consider Saturday and Sunday business days, even though we do business in the hospital on those days. So the patient portal, I think you can see the next one as well. Sorry, guys, I have a lag over here today. Maybe the rain is actually slowing us down. If you're sending items that don't require any response, like a non-action item, it may be, we might pass it to the person who's going to see you in a couple of days for your prenatal visit, and she can answer it then at your next appointment. We also are waiting for that slide. So this is for things like losing your lab slip, or let's say, you have COVID and you need to cancel your next appointment or convert it to a virtual appointment. As long as the appointment is more than 2 business days away, definitely send us a message, and the front desk is very responsive in answering them too. So if you send a message, look out for an answer because they are going to get back to you in a pretty timely fashion with regard to that. So things that you don't want to do with the portal is send us urgent messages like my blood pressure, I'm not feeling the baby move, I think I have an infection, I'm in preterm labor, having heavy bleeding. Those things are not for the portal because they should not be sitting there for 2 business days waiting for somebody to see them and respond to them. You also don't want to blitz message people. So remember, when you send one message, that person has 2 days. So, we had people sometimes will send, oh, I don't know who's on call, so I'm going to send a message to Dawn and Lauren and Jane and Missy, and get very upset when they go to the pharmacy and there are 4 different prescriptions waiting for them. Well, you messaged 4 people and we don't know that you're sending it to everybody. So in some ways that is portal abuse. And the portal will sometimes, if you copy paste messages to other people, think that you are a bot trying to spam us, and they will delete your portal account. And that's hard for us to reinstate. So multiple messages to one provider and or the same message to multiple providers. We ask that you don't do that. Also, please don't try to have your whole appointment over the portal. That people send me, pages and pages of articles and discussions and all sorts of things. And what's your opinion on this and your clinical that? And I'm happy to give you that in an appointment during the day when I'm seeing you. So the portal messages are things that we do after we've seen patients all day, reviewed all our labs, reviewed all the ultrasounds, and checked off all of our other tasks. This is our time that's supposed to be our family time. If there's something quick that we can do to make your life a little bit easier, we're happy to do it. But having more appointments at the end of our 12 or 14-hour day is not really what we want to do on the patient portal. So please schedule an appointment because we're here in the office, happy to see you and have those long discussions with you right here in person. All right. Patient portal is also the way we release your ultrasound results. Now, remember, ultrasound results, we upload the report from the machine, the ultrasound machine. It goes into our electronic medical record system. Then it gets divided among the providers to review. If there is something urgently abnormal about the ultrasound, we will not let you leave the building. I promise, I promise, I promise. My sonographers have been doing this for years, and they know what things require an immediate and urgent plan. So they will come and interrupt our day. This is one of the few times that we will actually disrupt our airtight schedule to talk to you about the findings, because we won't let you leave here if something urgently needs to be discussed and a plan needs to be made. Otherwise, that process I told you about where we each get the reports to review, please also give us 2 business days to receive them, review them, and release them to you. Now, if you know that your anxiety is not going to let you wait 2 business days to hear exactly what is going on with the baby, please be sure you get an appointment on the same day as your ultrasound so you can talk to one of the providers and she can go over a preliminary report with you. The final report will still be released to you in a couple of days, but we can at least kind of give you an idea if there's something that we're following up on, like you have a low-lying placenta, we can tell you, hey, it's cleared or it's not cleared. You're still going to need another ultrasound in, 4 to 6 weeks to see if it's still there. Otherwise, just give us a chance to get the report. Sometimes you'll see the sonographers typing away and you get nervous. You go to your car and you send a message. What does my ultrasound say? And the answer will be, I don't know yet, but I'm pretty sure it's not bad because we let you leave the building. So just remember that as a take home message. Quest also has a patient portal. They do. It's very annoying because they send the results to you before they send them to us. And then you see the results and they have red on them, and red is a scary color. But just remember, red does not necessarily mean that it is abnormal. The reference ranges that they're using for their labs are for non-pregnant people. And there are certain physiologic changes in pregnancy that make some numbers okay because it's pregnancy. So give us a chance to receive the labs from Quest, review them, and send them out to you. Um, if you've had the labs for over a week and you haven't heard from us, it could mean that Quest has not sent them to us at all. And so please then let us know so we can request them from Quest. Like, don't upload your labs because then we'll have multiple copies of it. And if we put notes on one, we don't want people to miss the notes because they were on one set and not another set. But just let us know because we can still get them from the lab if you already have them. And also, don't let red scare you. Any questions on anything about how to contact us? All right, cool. I think we are moving on to the next topic, which will be what to expect at your prenatal visits. Yes. All right, so first thing to expect is that pregnancy brain will make you forget everything you meant to ask us before you come to your visit. So start a text thread with yourself of your prenatal questions. Wear loose, comfortable clothing so we can access your belly. I don't think people are doing rompers very much anymore, but rompers are a terrible idea for prenatal visits because you have to take the whole thing off and then wrap paper around yourself, and you can't wrap the paper right. And, little T-Rex arms when you're pregnant. It's just, y'all look like you got mauled by a bear with that paper everywhere. So just wear something like a little shirt that you can lift up, or maybe pants that you can pull down a little bit because we need to get to your belly. I want to get to that belly. We're going to listen to your baby's heartbeat at every single visit. We're not going to do an ultrasound at every visit. We're going to listen to the heartbeat with the Doppler each time. So wear something loose and comfortable so we can get to that belly. Please get here about 5 minutes before your scheduled appointment so you'll have time to check in, solve any insurance things up at the front desk, and go to the bathroom. We're not routinely collecting urine samples. ACOG, the American College of Obstetricians and Gynecologists, says we no longer have to do that. We're only collecting them on people who were following protein in your urine for blood pressures or sugar in your urine for blood glucose. Or if you had a recent urinary tract infection and we need to check and make sure that it's gone. So you'll know if we need to get a urine sample from you. But if not, you're pregnant, you've been drinking your water the whole way here, I know. And so when you get here, you have to go to the bathroom. So please go on to the bathroom so that we can be in place to see your provider at your designated time. If you're 10 minutes late, we will still have time to check on you and your baby. That obviously leaves less questions for your text thread, which we want to know what's going on in your mind. What questions do you have for us? But if you're 20 minutes late, you've missed the whole appointment slot. And the next person behind you, we want to be respectful of her time because if she did get here her 5 minutes early, and we understand sometimes there's accidents. And if we notice 10 people are calling at a time saying there's an accident, I'm going to be late, we're not going to turn people away because we know everybody's going to be late in succession. But if it was just you, and you missed your appointment, sometimes, like I said, if there are openings later in the day, front desk is really good about looking and seeing, she's not going to make it. She's not going to hit this 2:20, but I see there's a 3 o'clock over here on her schedule. By the time you walk in, they may already have that proposition ready for you. And if that doesn't work, you've got someplace else to be, no big deal. If we can't work you in later in the day, then we'll reschedule to a date that makes sense for both of us. All right, when are you getting ultrasound appointments? Man, y'all have great questions today. So ultrasound appointments are separate from your prenatal visits. And the way to know if you have an ultrasound scheduled is to look in your portal. Do you have more than one appointment time? And is there a provider's name associated with your visit? If Tina Test, my fake patient who I use, looks in her portal, she clicks on the appointment button and she realizes that she has two appointments on the same day. What? So the first one is at 9:20 with ultrasound. Ultrasound is not a provider's name. So if any of you want to name your baby ultrasound, that name is not taken. Then she has an appointment at 10 o'clock with Dr. Yeckel. Dr. Yeckel is a provider's name. So Tina knows that she has two appointments that day. So if she wants to bring her family to see the baby, they should be here for the 9:20 visit. They're welcome to stay for the 10 o'clock visit as well. But if they have to scoot back to work or other duties, then they know that the first appointment is the one that they want to be there for. If you think you're supposed to be having an ultrasound coming up, please let us know if you don't see it on your portal, but you thought you scheduled one or somebody told you to schedule one. And do remember that the results from those ultrasounds will be sent to your patient portal within 2 business days, unless there is something urgently abnormal. And in that case, we will not let you leave the building unless we put you in a room and talk about what we saw and make a plan with you. So as you're checking out from your visit, if your provider says, oh, it's time for your ultrasound, you need to get an ultrasound for this, that, and the third, when you check out, be sure you get more than one appointment time for what's coming up to be sure that you've scheduled both your return prenatal visit and your ultrasound visit. All right. If you think you should be getting more ultrasounds, but we're not doing them, silly us, there are boutique ultrasounds out there. So you can look at your baby whenever you want. These that are listed are for informational purposes. There are a bunch more. I know there's one down in St. Augustine too. So we're not like saying these are better or, what have you. We're not endorsing any particular place. But these are all over town, trying to put one in each different area. They do cute little things like put the baby's heartbeat in a stuffed animal, and you get all these 3D pictures. Super cute. Your family can come with you. So if you want to look at your baby more and there's no medical reason for it, then you have a fun reason to do it. Go to a boutique and let them look at your baby. All right. All this talk about ultrasounds. I have a poll question. When will we get routine ultrasounds? And routine is the key here. I think my veteran mamas who've done this before know exactly what I'm saying. And the polls will be closing in 5, 4, 3, 2, 1. Boom. All right. I didn't catch anybody with the at every visit this time. We will listen to baby's heartbeat on the Doppler with every visit, but routine ultrasounds are at 20 and 40 weeks. That is routine. If there is a problem, like something we need to follow up, I keep using the low-lying placenta because it's so common. That is a problem visit, and we will follow it up with additional ultrasounds, but that's not routine. If we see everything where we're supposed to see it at 20 weeks, you shouldn't need another one until after you have passed your due date. All right, we are going to shoot over to the website now, I believe, fullcirclejacks.com. And we're going to find a bunch of information there. So the first thing we'll see is that town hall meeting that I held back in October. For those of you who delivered with us at Ascension before, this explains why we made the switch to HCA Florida. Back then, it's been a really good move. I keep waiting for us to hit the 200 mark, but we're rapidly approaching 200 deliveries there now. If we haven't already passed it. And it's been really smooth, like no complaints. So it's been a good move. We're going to start here with the providers. So for those of you who were looking for an all-female crew, you found my all-girl band. And these are our providers. There's me, there's my bud, Dr. Marrow, there's my friend, Dr. Yeckel, and there's our sweetheart, Dr. Mooney. And then we have the midwives as well. There's midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. The ones you're most likely to see here in the office are Jane, Missy, Dawn, and Lauren. So be sure you get appointments with each of them because they are the ones who are most likely to be standing in attendance at your delivery. You can click on our bios and learn a little bit more about each of us as well. Then we shoot over to patient information. You'll see the obstetrics tab, and you'll know you're in the right place when you click there because you'll see all the bellies leading to the baby. And we started off with our delivery stats. So many of you are with us because of our delivery stats, trying to avoid unnecessary cesareans, looking for support for birth choices and autonomy. Our numbers go back to 2018 here, and we're very proud of our statistics and very transparent. Some years are better than others, but we're still going to let you know how it's going. Our next box we have over here is the prenatal care timeline. And let's see. Ooh, there's a question in the chat. I'm excited. Oh, do midwives deliver VBACs? Yes, they do, and beautifully. Some really lovely VBAC deliveries. If you follow us on any socials, you can go back and see some of the really cool stories of midwives delivering our vaginal birth after cesarean. Good question. Okay, so this is what you're going to expect at each visit. So everyone on this call has already had their first prenatal visit at 8 to 10 weeks, which was your confirmation visit. You had an ultrasound and you talked to one of the midwives and then did some other stuff. And they told you you're going to have this meeting with Dr. Adams and that meeting with Dr. Adams. And you said, why can't I ever see her in person? I'm like the wizard. No one sees a wizard. All right, so some of you have already had your OB history visit with me, and we ordered some prenatal labs for you. We talked about genetic testing options. It's probably 50-50 who opts in or out of the different genetic options testing, the options for testing. If you're planning the nuchal translucency ultrasound, that's done between your 12th and 13th week. If you're doing the NIPT, it's done after your 10th week at any point. Um, at this point in pregnancy, we're seeing you every 4 weeks. So about 4 weeks after your initial OB visit, you're scheduled for your physical exam. Because I know at the beginning they were like, you have an appointment for this, this, and this. You're like, whoa, I just met you. Buy me dinner first. But the OB physical exam is just like a regular annual exam, heart and lungs, breast exam, pelvic exam. If you're due for a PAP, you have the option to get that done there then, but you don't have to. It's not part of the prenatal panel, just cervical cultures. So we are very transparent in the labs that we're ordering here. This is the panel recommended by the American College of Obstetricians and Gynecologists. For those who have high risk issues and need to see the high risk doctor, typically your referral will be sent really when you see me at your OB history visit. But definitely, most people have seen them by the time they're at the 14-week mark if they were on the track of being confirmed at the right time. About 4 weeks later, you're back in the office. We're doing a second trimester check, talking about some of the fun things that happen during second trimester, because that's when you start to feel your baby move, which is super cool. And then around 20 weeks is when we do your anatomy ultrasound. So you'll see in the middle column too a mental health screen. So right around that visit is when we start screening you for anxiety or depression, because we know pregnancy is a roller coaster of emotions due to hormones. And we want to make sure that we're getting ahead of and or identifying any issues early on. If you need to meet with a midwife on the same day as your ultrasound, this is around the time she starts talking about childbirth education classes and or breastfeeding classes. So about 4 weeks after that, we look at the glucose test. And I know you have questions about glucose. I'm going to answer those later. So put a pin in that for a moment for me. My mom's whose blood type is Rh negative. We want to make sure that your labs are current in terms of your antibody screening so we can get ready to administer RhoGAM to you around 28 to 30 weeks. And then we're going to get you the information to pre-register at the hospital. It's all online at HCA Florida, so you'll scan the codes for that and fill it out. Schedule your hospital tour. If you're planning on working with a doula, this is when you want to get her locked in. We're going to talk about doulas in a little bit as well. And then we ramp it up to seeing you every 2 weeks. So you can see there in the middle, it says you have the option to repeat or decline your standard prenatal labs. So ACOG has one recommendation. The county health departments have different recommendations based on the populations that they serve. We have a lower risk population generally in terms of stratifying what was happening in the county. So if you feel you are part of the low risk population of getting an STD while you're in pregnancy, we do have an option for you to sign that you were offered and you decline it. Around that time too, if you are planning to get any of the third trimester vaccinations, there is a tetanus vaccination, the Tdap, flu shots. I don't think y'all are going to be pregnant during that time for third trimester, or RSV, honestly. If you don't already have a pediatrician, so first time mamas, this is when you want to start doing your interviews for pediatrics. And what you want is somebody who's aligning with your philosophy of how you want to treat your child if he or she or they have any issues. Veteran moms, you want to decide if you're going to stay with the same pediatrician because almost none of them come to the hospital. So you will need to know where to send babies' records. So we go with the every 2 week visits then until about 36 weeks. And during that time, moms who develop any issues with their pregnancy, like high blood pressures or high blood sugars, may start additional testing. My moms who are intending to have a belly birth, meaning which is our term for a cesarean delivery, we usually get you scheduled for those. The books open up about 2 months out. So around 32, 33 weeks, we'll be able to get a date for you so you can start planning. At the 36-week mark, we do a pelvic exam for group beta strep, which is another pelvic. If you've already opted out of repeat STD testing, you've opted out of repeating cervical cultures as well. You don't have to sign a second form for that. And this is when we start seeing you every week. Yay. So after your 36 weeks, at the 37-week mark, you are full term. So please bring in your birth preferences for discussion. You can start your natural cervical ripening methods. At 39 weeks, typically our belly birth mamas get off the train. And those who are waiting for baby to give the signal, you'll be patient, because the average time for first time moms to go into labor is about 40 weeks and 5 days, which means you're close to about a week after you're due. And that's just the average. Some babies like to snuggle as long as they can. We want everyone evicted by 42 weeks. So first time mamas, 41 weeks and 5 days is when we would typically start an induction for you because our inductions are not fast and harsh. They are very slow and gentle, and it might take 2 days to get this baby out. Second time mom is usually you're faster, so 41 weeks and 6 days for you. So just remember to reference what's going to be going on at my next visit. Do I have to take my pants off? Nobody wants to be surprised by that. Remember to refer back to this, so you'll know what to expect at each visit coming up. So again, as we go back to the website, just remember first time mamas, the average length of labor is about 24 hours. So just know it's not like a sitcom. It will take a little bit longer and we will wait. We got nothing else to do. All right, pregnancy safe medications. Let's ask a poll question. If you have a headache during pregnancy, are you more likely to medicate, or evacuate your house and go to the emergency room? And while you guys vote on this, I'm going to look at this question here. Do you offer elective inductions after 39 weeks? Yes, we do offer them. If you're planning an elective induction and it's your first baby, there are a number of factors we'd like for you to consider because there are a number of factors that could increase your risk for a cesarean. But those are just things for you to consider. After 39 weeks, it's definitely your choice. If it's not your first vaginal delivery, we're more inclined to, not necessarily need to consider all of those different things. But that first baby, really have to be careful. Okay, so we have more medicators than meditators here. And, it really just depends on the day, what I might decide to do. But many of you have already talked to and you say, oh, I'm having these pregnancy headaches, hormonal headaches, but I can't take anything because I'm pregnant. False. Here is a list of things that you can take. These are safe medications in pregnancy. So they're listed by discomfort, alphabetized the common pregnancy discomforts on the left. In the middle, you'll see some support measures, like relief measures that we recommend that you try first. If you've exhausted all of these and you're like, well, I got to go to CVS. These are things that it's okay for you to purchase over the counter. Some of them are more Western medicine, like you'll see, Tylenol and Zyrtec and Benadryl. Some are more Eastern, like your aloe tablets, your magnesium, I think peppermint oil and B complex and things like that are on there. But we are still in the season of now there's more congestion and all that stuff with the pollen. The pollen is killing me today, by the way. But the same stuff up there for congestion is also for allergies. So Zyrtec and Benadryl and Claritin are just fine. There are some caveats in here as well too. So if you had nausea, vomiting, can't keep anything down for more than 24 hours, definitely let us know because you need to get hydrated. And some things you want to avoid like Pepto-Bismol and things like that. So just remember that this list is out here because if you send any of us a message, hey, I'm having constipation, is there anything I can do? I promise. The first thing they're going to do is send you a link to this. So the ones who've gotten smart send me a message. Hey, Dr. Adams, I've already tried everything on your list online. What can I do about this? And so then we have a productive conversation from there on. So definitely look at this list first because it will be the first place that we refer you. If you're old school like me, you can print it out, stick it on the fridge, or you can download it to your phone. All right, next box there is gestational diabetes screening test. I told you I was going to come back and talk to you about this, but it's not right now. It will be in a little bit later. So just hold on a second and remember that this box is out here. Weight gain during pregnancy. All right, some of you are very concerned because you gained no weight at all already and you're a whopping 10 weeks. It's okay. Some of you are very concerned because you have gained a lot of weight and you're a whopping 10 weeks. So, how much weight should you be gaining? It depends on where you start. So, there's a link on here that you can click on to put in your height and weight. It'll calculate your body mass index pre-pregnancy, your pre-pregnancy weight. That gives you your body mass index category, and based on that is your recommended weight gain in pregnancy. Now, if you're carrying twins, you get to add 10 pounds to the upper number for each of those ranges. But you'll see over here in this last column that the rates of weight gain are in second and third trimester per week. So first trimester is survival mode. It is just no, nothing tastes good, nothing sounds good, nothing smells good, everything comes back up. That's okay. You're not supposed to be gaining weight during this time. Babies are adorable little parasites. So your baby is getting everything he, she, or they need from you right now, which is why your vitamins are important if you can keep those down, because that's really to sustain you, because your baby is going to take. And in second and third trimester, you will start to gain weight again. So don't worry, it will come back around. Food will smell and taste good again, I promise. Sometimes too good. All right. Birth preferences are next. So we're going to click on this one for sure because many of you are interested in making a birth plan. Birth plans are great to decrease anxiety. So first-time moms, you've never done this before. And if all you have out there telling you what's going on is social media, one, I really feel for you because there's so much bad information out there. And so many people trying to make you feel badly for choices that are just your opinion. So everything on this list is personal opinion. There's nothing dangerous about choosing anything on here. But sometimes writing down things to go a certain way or the way that you would like them to go can help decrease some of the anxiety about the unknown. So this covers everything from how you'd like your labor to start, when you'd like your labor to start, or what you want to wear during labor. Do hospital gowns freak you out? Don't wear it. Go on Etsy, get yourself a cute little gown that's going to get very messy, but it's still your Etsy gown, and that's okay. In terms of pain relief, you'll see, there's epidurals and IV pain medicine. Obviously, we're a hospital, but we also have hydrotherapy. So there are tubs in which you can labor. And there's nitrous oxide as well. We're very excited about that addition very recently. Other things I want to highlight, we're not starving you, we're not strapping you to the bed. If we have no other, contraindication for you to get up and move around, we like for you to be able to shift positions, labor in different positions, deliver, push in different positions as well, because when you and baby are both active participants in labor, it's shorter and it's easier for all parties involved. So this continues on to the second page, and you'll see our standard is delayed cord clamping, immediate skin to skin, early latching. The standard medications offered to the newborn are listed on here. You always have the opportunity to bring this in and ask the midwife, what is this medicine for? Does this apply to me? Is this a good idea? Do y'all recommend it? Is there evidence behind it? Circumcision is on here as well as feeding. And for my twin mamas out there, you have options too with regard to who's in the room, skin to skin between delivery and pain control. And then my belly birth mamas, we do gentle cesareans. And so that is a family-centered birth where we make sure that it feels less like an operation or procedure and more like a birthday party, because who doesn't love a good birthday party? As we go back to the website, cervical ripening techniques are out here as well, because at the end, all you're going to be asking is, how do I get this baby to leave? And these are different things that you can do to tone your uterus, soften your cervix. These things are not intended to put you into labor, but just to get your cervix ready to accept baby's signal that it's time for labor to start, because your baby actually gives the signal for labor to start. So you'll see kind of week by week what things we recommend here: acupuncture, acupressure, evening primrose. There are dates on here, breast pump, and all that good stuff. The thing that you will not see on here is castor oil. And if you have never tried that when you're pregnant and you have questions about why I didn't put that on there, you can ask one of the midwives in one of your upcoming prenatal visits, and they will have a story for you. I'll tell you that. All right, so just remember this is out here as well. So you do not need to go scouring the internet about what things you can do to get your baby to leave. The next box is super important. I'm guessing I have at least one VBAC mom on the line because of the question that came up before. Is there anyone planning for a vaginal birth after cesarean? Obviously, first time moms doesn't apply to you, but all right, so here we go. We do have somebody out there, and there are only two options. Either it doesn't apply to you, or yes, and you're going to rock it. All right, very good. But this box, this square applies to first time moms for sure, because really you and VBAC mamas are trying to do the same thing, which is avoid an unnecessary cesarean. So babies are going to baby, they're going to do whatever they're going to do, but there are things that you can do to control some parameters about your labor. So please control what you can. If you know this is specifically for the VBAC mamas, if you had a previous bad birth experience, please address what happened in your last birth. Don't let that negative energy cloud and confound what's happening with your body this time. For everybody, chiropractic care, pregnancy yoga, Pilates, daily squats. Don't overgain weight. Don't go crazy on the cupcakes, the baby shower, and all of that. Get yourself a good doula, spinning babies. You guys can read. But most importantly, the thing down there is just trust your body and trust us. Like we didn't get our stats by trying to work against and sabotage people. We want what you want, the safest path to the delivery that makes you feel honored, supported, and accomplished. So first time mamas, remember this is out here. And my VBAC mama, you're going to be successful as well. Don't mess up my stats, girl. All right, let's go back to the other page. And the last thing on here is the circumcision care. So if you have a little guy and you'd like for him to come hang out with us to get his pencil sharpened, we do circumcisions in the office before babies are 10 days old. We don't do them in the hospital because, I mean, he was just born. He needs a little bit of time to learn to be a baby. So what happens is you just tell us after delivery that you want to schedule a circumcision for him, and we let our OB coordinator know, and she will reach out to you with his little appointment time. We'll take good care of your little guy. All right, so remember all this stuff is out here as we go back to the presentation and have a little conversation about nutrition. And on this first page that you're looking at on the presentation, you might feel attacked because I do, for sure. Those who are concerned because Dr. Adams, I've already gained 10 pounds and I'm only 10 weeks. Am I going to keep this up? Well, maybe. All I'm drinking is coffee. Are you? Or are you drinking this? Because on the left is coffee. On the right is a salted caramel mocha monstrosity that is so delicious, but so packed with all the bad things. Did you know that pregnancy only requires an additional 300 calories per day? It takes 10 kilocalories to maintain a pound, and the number of pounds that you're supposed to be maintaining is based on your starting body mass index. So you're starting the pregnancy at 170 pounds, and your goal pregnancy weight gain is 25 pounds. You need 1,700 to maintain. You'll need an additional 250 to maintain what you're trying to gain, for a daily total of 1,950. Now, if you divide that between breakfast, lunch, and dinner, that's 650 calories per meal. And babies don't know whether you're eating your calories or drinking your calories. So if you're like, I'm eating 650 calories per meal, and then you're washing it down with a 570 calorie drink, then your baby's going to take those 300 calories off the top, for regular growth, and then leave the rest for you. Happy Mother's Day. But also just know that at some point, baby will start absorbing those other calories too, and you may start to grow a monster baby too. So, things to look at when you flip your food over. I know this is a really busy slide, but just taking a look at what things you want to limit and what things you want to get enough of, and simple changes you can make that can make a big difference in not only your comfort, but your pregnancy health. Because at the end of pregnancy, I'll start sending these messages, Dr. Adams, I can't get any of my rings off. My fingers are so big. And the first question I ask is, hey, what you have for dinner last night? You're like Chinese food, or I went to Arby's. Okay, sodium. You want to keep your sodium low, and there are certain things that when you're buying them, you can just flip it over, and a very quick substitution can save you a couple hundred milligrams of sodium for the day. All right, so what things are we allowed to eat then? Good question. Fruits, vegetables, whole grains, cereal. You're not going to give your baby allergies to nuts or dairy if you enjoy them, so please go ahead. For my coffee drinkers, you want to keep your caffeine under 200 milligrams per day. So that's like 4 Starbucks calls, I think, which is, I think is still a lot of coffee and a lot of caffeine. Do remember toward the end of pregnancy, though, if we start hearing irregular heartbeats with the baby, the first thing we're going to say is try discontinuing caffeine. So I always say if there's a limit to something, always see how close you can get to weaning it so that if you had to abruptly stop it, it's not such a powerful impact for you. And also remember, caffeine is a diuretic, so use the 3-to-1 rule. As if you're drinking coffee, drink 3 times as much water so that you're not getting dehydrated. That looked like product placement, but it wasn't. They're not paying me. Unless you share this with them, I'd be happy to be paid by Core. Their water's delicious. Herbal teas are fine. These are our favorites for pregnancy. There's raspberry leaf, there's ginger, lemon, and peppermint. For my bodybuilders, for my vegetarians, my vegans, your protein intake, you want to keep it around 70 grams daily. I know there are some pregnancy diets out there that tell you to cram 120 grams of protein daily because they're trying to avoid high blood pressures and things like that. You may be successful in avoiding that with high protein, but you may also grow a 10 or 11-pound baby. Life is about choices. So protein around 70 grams gives you enough so you don't have these scrawny little malnourished babies, but also you're not growing monster babies. Deli meats. Yes, you can. You can have deli meats as long as you microwave it for 30 seconds to make sure you kill any harmful bacteria. It does not have to be so hot that you're burning your mouth, straight out of the microwave, but just be sure that 30-second goal is reached. For your soft cheeses, if it's made with pasteurized milk, just kind of flip it over, but if you're at a restaurant and you can't tell if it's pasteurized milk or not, maybe you skip the brie for the evening. Canned tuna, you can have 3 of those 4-ounce cans per week. If you're a pescatarian and you're wondering which fish can I have, which ones can't I, it does change seasonally, and the FDA has a really nice document out there about it that changes. You can tell I've been doing this presentation for a while because the date on there is old, but it is updated with fish that you can eat. You should eat a lot of because they're high in omega-3 acids, which are good for baby's brain development, things that you can eat sparingly, and ones to avoid because of things like methylmercury. So remember, this is out, it's like a 2-page document. So I'm just leaving the link out there and it will be on our YouTube channel. You can see it later. So things you want to avoid: undercooked fish, undercooked meats. So if you are a foodie like me and you love your ahi, sushi, tuna, or your medium rare steaks, you will need to ruin your steaks for the next 6 months and have them well done. So sorry. For my kombucha drinkers, my kimchi eaters, those are fermented beverage, fermented foods if you're eating them the traditional way, and your body treats them as such. And so we do not recommend large quantities of those in pregnancy. Alcohol, the same thing. We don't know how much alcohol is safe in pregnancy either, so we don't recommend intaking that. And your sodium overall, again, you want to keep under 1,500 milligrams per day. And once you start flipping your food over and seeing how much sodium is in things, it will be appalling that your limit is 1,500 per day. All right, any questions on food before we move to exercise? All right, maybe not a crowd of foodies here. Maybe you guys are my exercise crew. Okay, it is just fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. But you kind of won't feel like it in the first trimester. So, second trimester, you're going to increase your blood volume by 50%. That increases your oxygen tensions and saturations, which will make that aerobic activity easier to tolerate. So those physiologic changes will accommodate more activity. So just listen to your body. You'll build back up to what you were doing before. You just may not be able to do it in first trimester. Now, if you weren't doing anything before, no shame, no judgment, maybe a little, but no, not a lot. So if you weren't doing anything before, it is just fine for you to start a new pregnancy regimen. Like it doesn't have to be anything crazy. But please remember that sedentary lifestyles lead to malpositioned babies. So I know a lot of people are working from home now, sitting back at the computer like this. Get one of those the balls, the birth balls that you can sit on to maintain your posture. Because the most common reason we're doing C-sections is not baby's too big, baby's in distress. It is baby's head is crooked, baby is malpositioned in the pelvis and can't work his or her way out. If you have one of these fancy little Fitbit watches and you're monitoring your heart rate and giving yourself another reason to be anxious, and you've noticed that your resting heart rate has gone up 10 to 20 beats per minute, that is normal. That is physiologic. And as long as you're not getting lightheaded, dizzy, or passing out from the increase in your resting heart rate, it is fine. You'll just monitor it. It'll come back down when you're not pregnant anymore. It's a normal change. All right. So, some of you have said, well, yes, I do exercise a lot. I walk a lot at my job. All right. So walking can be considered exercise if when you walk, your heart rate is in the aerobic zone. So the aerobic zone is 70% of your max heart rate, and your max heart rate is just 220 minus your age. So let's say you're 30 years old. You start with 220, you subtract 30, which gives you 190. You should not be exercising for sustained periods of time with your heart rate above 190. It's a question I get a lot. Your aerobic zone, though, is at 70% of that, so 133. So if when you walk, your heart rate is between 133 and 190, sustained for 30 minutes, 3 times a week, then walking is exercise. If when you're walking around the job or from your car to the building, your heart rate is still, hanging in the 90s and the 100s, that's not your aerobic zone. That is transportation. It is not exercise. Let's find something else for you to do for exercise. Well, what things can I do, Dr. A? Oh my gosh, I'm so glad you asked. So you can do cardio. You can get on your treadmill. You can hit that elliptical. You can go ahead and run. You guys get to swim. Y'all are my swimming crew. And I love summer pregnancies for this reason, because that pool, that water, the ocean makes your belly weightless and you can really move around without aching joints. Indoor bike is fine as well. If you are on a Peloton, my leaderboard name is Off My Meds 8. If you follow me, I do follow back and we can keep each other honest. I just did my 300th ride. Very proud of myself for that. If you were lifting weights before, you can lift up to what your pre-pregnancy level was. You don't need to increase your resistance during pregnancy. Your baby and your body are going to be doing that. Squats are my favorite. Please, if you're an experienced squatter, please keep going. If you have not been squatting before, now's a great time to start. So 20 weeks, you give me 5 squats a day. 21 weeks, you give me 10 squats a day. 22 weeks, you give me 15 squats a day. People are always like, oh, I want a prenatal visit with Dr. Adams. Well, I do very few prenatal visits. And then when people get them with me, I'm like, hold on, let's do squats through your visit. What? And then suddenly nobody wants prenatal visits with Dr. Adams anymore. I don't care. My feelings aren't hurt. Pregnancy yoga, pregnancy Pilates are my faves as well, because remember, those also make those muscles long and lean and everything stretches out. Experienced Pilates instructors, experienced yoga instructors will know what modifications should be instituted for pregnancy as well. So things you want to avoid during pregnancy. It's the high intensity interval workouts, and it's not the intervals, it's the intensity. So you can do the low impact version of those, because it's the sudden jerking movements that can create shearing forces on your placenta, and we don't want that. After first trimester, if you've already been doing it, it's fine. But once your placenta gets bigger and carries more weight, we don't want you shaking it around. Anything that has you lying flat on your back for extended periods of time, like excessive ab work. So you can do side lying abs, you can do standing abs, that's fine, but just not the, crunches straight from your back. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment. Otherwise, you will get very dizzy, you may pass out, you may fall. We don't want you to fall on your belly. Also, you want to avoid scuba because of the changes in barometric pressure, which will decrease oxygen to the baby. Same thing about high altitude hiking. So 7 to 8,000 feet is what you kind of see in some of the places. I mean, you can visit high altitudes, like you can go see your family in Colorado, just don't go hiking with them. Contact sports, please do not take up kickboxing during this time. Volleyball is another interesting one that people do during the summer. All the jumping and diving and having a ball flying at your belly, please try to avoid that. And then outdoor biking after 16 weeks is not an absolute no, but it's just kind of a keep in mind at 16 weeks is when your center of gravity changes. And so when you go to turn corners, your body kind of pulls you more over to that side, and you may find yourself falling off the bike more than hitting that corner appropriately. All right, questions about exercise before we do this poll question? All right. No, no diet, no exercise. Okay, just quiet crowd. All right, can you prevent gestational diabetes with diet and exercise? Remember, I said I was going to talk about gestational diabetes. Here it is. All right, can you prevent it? That is the major word here, prevent. My veteran mamas know me and my tricks. Poll's over. All right. So the answer is no, you can't prevent it. You can manage it, but you can't prevent it. And let me tell you why. Because this is why we screen everybody for gestational diabetes, because your number one risk factor for gestational diabetes is your placenta. Your placenta gives off hormones. We all know that. And we are very happy to blame our hormones for almost anything else. But gestational diabetes is due to your hormones as well. So your placenta gives off hormones that tell your insulin not to do its job. And the job of insulin is to clear your bloodstream of glucose. And if you have excess glucose around because your insulin is not doing its job, that is glucose diabetes, which is gestational diabetes. So, gestational diabetes is only because you have a placenta. So, this is not a judgment on your lifestyle. It's not a judgment on your family history, on your body habitus, or any of that stuff. This is just if you have a placenta, you are at risk. My twin mamas, you have two placentas, so you are twice as risky. So, if you can figure out how to do this pregnancy without a placenta, then I will not screen you for gestational diabetes. But everybody on this call with a placenta, please expect me to screen you for gestational diabetes. Um, if so, my moms who say, "Oh, but I never, eat any sugar at all." You eat good sugars, right? So don't avoid your carbohydrates prior to the test. Like don't shock your body into having, a larger load of sugar. So your fruits, your whole grains, those things are okay to eat right up to the test with the parameters that we have on our website in terms of how long to not eat before the test. If the drink itself is what is giving you trouble, I have options. So there's the Simply Pure drink, which is available in our office for sale. It is soy free, it is dye free, it is gluten free, it is BBO free, it is kosher, it is vegan, it is offensive to almost no one. And you can purchase that. Let us know if you plan to purchase Simply Pure or any of the other patient driven options that are on the website. Remember that little box we didn't click on? That box has fresh tests, glucoorganics, glucose tabs. If you plan to do one of those, let us know because Quest does not accept outside alternatives to the drink. So we would send you to LabCorp or another lab. And we need to write it on your lab slip and give you the instructions, like don't drink it before you get there, all that sort of stuff. So let us know if you plan to do one of the alternatives for glucose screening, which is, as I mentioned, around 24 to 26 weeks. All right, more preparing for birth. So, for those who are looking for unmedicated deliveries or to delay an epidural so that it does not increase your risk for a cesarean by getting it too early, childbirth education classes are available in the community. So there's a hand to hold, birth your way. These are representatives. These are representations of different method classes like hypnobirthing, hypnobabies. I think Lamaze and Bradley method are out here as well. For my dads who are looking for what to do because you're walking on eggshells because you feel like everything you say is wrong, it will continue to be wrong unless you look at this course, Supporting Her. Supporting Her was designed to help keep you out of trouble and not get your fingers bitten during labor too. So just know that there is some help for dads who don't know what to do as well. Again, these are for informational purposes. There are lots of other classes available in Jacksonville too, so feel free to look any of those up too. On our next slide, we have more preparing for birth. So breastfeeding classes, we can connect you with La Leche League. Every new parent should know CPR. or at least get a refresher. Like if you know adult CPR, infant CPR is different. It's not just, doing it with one finger instead. This is a link to the Red Cross. You can take a class, or Jax Mobile is actually someone who will come to your house and do a CPR class and get you certified. If you're already seeing a chiropractor, good for you. Just make sure that he or she is Webster certified, which is a special pregnancy certification that deals with some of the physiologic changes that occur in pregnancy so that they can adjust your adjustments, so to speak. All right. Who is planning on working with a doula? I know some of you I talked to already. I was like super impressed. You're 8 weeks. You're like, I already have my doula and my pediatrician, and I've already started. Like, whoa, that's amazing. All right, polls are closed. Okay, cool. So it's pretty even split there, but more people than not plan to work with a doula, and some are not sure what doulas are for. Well, let me tell you. Doulas are here for emotional and physical support before, during, and after pregnancy. So your doula is the person who helps you get into different positions that make labor less uncomfortable, positions that encourage baby to descend in the right position as well, help you to relax, remember your breathing, advocate for you, get different things to help, like pillows and ice and water and whatever, juice things, whatever you need. Your doula is there to help you get more comfortable and help you remember things that are on your birth preferences, because in the heat of battle, you won't remember that number 37 on your birth plan is, and please don't have 37 things on your birth plan, but your doula will be there. And doulas usually bring people to us because they know that, again, we want what you want, and they can spend their time supporting you instead of fighting us. So we highly advocate for doulas. I actually just spoke to the Florida Hospital Association last week, encouraging hospitals to partner with Healthy Start to provide doulas for all of their patients, so everyone can have access to doula care. Doulas are not clinicians. You're like, wait a minute, I thought I had a midwife and a doctor and a nurse. Who are all of these people? Doulas are not giving medical advice. They're not giving medical care. They're not prescribing medicine. They're not going to deliver your baby. That's what you're hired us to do. And so we'll do those things, but we all work together as a team to make sure that you are getting the safest birth that does not traumatize you and, again, makes you feel respected, autonomous, and accomplished. So again, we love working with doulas. If you are looking for one, matching your personality is probably an important thing too. So ask the midwives. They have no shortage of opinions on who the best doulas that they've worked with, the ones who will come to your house when your labor starts, come with you to the hospital, and they stay with you until that baby is latched. I mean, they do not leave their post. They are amazing, amazing people. All right. Acupuncture is also a good way to prepare for birth. Actually, acupuncture throughout pregnancy it can be really good for morning sickness and help a lot with discomforts of, sciatica or back pain during. And then when it's time for baby to get out, you can do the baby come out acupressure points as well. Same thing with pregnancy massages. Most places won't do them in first trimester, not because it's actually dangerous, but because first trimester is when the majority of pregnancy loss occurs, unfortunately, and they don't want you to blame yourself or them if anything untoward were to happen to your pregnancy. Some places will still require a letter from us, and we do have a standard pregnancy massage letter. So if you plan to get a massage and they're asking for a letter, just let us know. We have one that says that it's okay and actually encouraged for you to get pregnancy massages. Many of your insurance companies cover breast pumps. So please do not go out on your own looking for a way to get that done. We have done the legwork for you. There are QR codes in all of our exam rooms. So around 20 weeks is a good time. So when you do your anatomy ultrasound or so, let that think, oh, okay, breast pump. You can scan that QR code. It's very easy. You fill in your information online. They fill out a prescription, send it to us. All we have to do is sign it. They check your insurance, see which pumps are covered, ask you which one you want, send us the prescription already filled out, and we send it back. Very easy. Sometimes y'all go and find these companies that ask all these unnecessary questions. They want copies of your records, your dental x-rays, like just it's too much. All they need to know is that you're pregnant from us and that you can have a breast pump. And we're happy to tell them that with this very easy way. So At any time, at any point, we have about 300 to 400 pregnant people in the office. So please don't make us dig up dental records on every single one of you. Just scan our QR codes. Please and thank you. All right, postpartum stuff, because one day this pregnancy will be over. So glad we've had this time together. Blood pressure checks for my mamas who have had blood pressure issues during or after pregnancy. We want to see you back in the office within a week. Incision checks for my belly birth mamas, we see usually about the 2 week mark. Routine mental health screens after 2 weeks for everybody. The first 2 weeks, baby blues, 80% of moms are going to have some tearfulness, just a lot of emotion. That is not a great time to screen for real depression. If it persists after that, though, that's when we want to do the mental health screen and see if we can, again, get ahead of some of this. Postpartum doulas. Remember, if doulas are there for physical and emotional support, when do you need that more than right after you had a baby? So, postpartum doulas, we can definitely refer you to those in the community as well. The motherhood space is a relatively new and amazing resource. Jacksonville is one of 5 cities in the country that received a grant for this. And it is basically like postpartum play dates for moms. So you go to the Y that's up on the river, the Winston Y, and you do yoga, and they have music therapy, and they have a psychologist there who do group and one-on-one sessions. There is free childcare. It's covered by insurance. Children, I think, age 6 weeks to 12 years old. So you can bring all your other kids too and just get some mommy time up there to really take care of your mental health. And then pelvic floor therapy, which is the standard of care in Europe. America, the little engine that could. We're trying to catch up. So we have a nurse who comes in 3 times a week to do pelvic floor therapy, and this is for feelings of pelvic heaviness after you deliver. Things we don't really talk about for moms is how your pelvis feels after a human passes through it. So this addresses, continence issues, prolapse issues, all of that stuff. If you had a tear or repair, this helps to re-strengthen your pelvic floor. And so typically at the 8 week mark, we start you routinely in your 8 week journey on pelvic floor therapy. All right. Any questions on the postpartum stuff? Okay, cool. Random FAQs. Yes, you can sleep on your back. Yes, you can sleep on your left and right side. If it freaks you out to sleep on your back or you wake up gasping for air, you can get one of those wedge pillows they sell at Amazon. Just slide it under one hip or the other, and it keeps you from rolling all the way on your back. You can help paint the nursery. That's a very sweet time. Just make sure you're in a well-ventilated room and or wearing a mask. You can take probiotics during pregnancy. You can get gel nails and dye your hair. Hair dye includes dyeing your eyebrows. That was a question that I had. The gel nails, if you're going to be in the salon around the fumes, you may want to wear a mask for that, just so you don't get sick. Car travel, this is the summer break crew. So yes, you can travel in the car. Up to 37 weeks, you can be more than an hour away from us. I don't really recommend being far away from us when you are full term. Be sure though, if you're on long trips, you're getting out and stretching your legs every 2 hours, which you will definitely do if you're drinking the proper amount of water. You can also use your topical skin agents like salicylic acid and benzoyl peroxide, just nothing that has retinol in it. If you're looking for a natural alternative to retinol, bakuchiol, Bakuchiol, is a natural alternative that does not have the harmful effects of retinol for pregnancy. Air flight, air travel is fine for my twin moms up to 32 weeks, for my singleton moms up to 36 weeks. Just be sure that you are wearing your compression hose and doing your toe raises while you're in the seat and staying very, very hydrated. If you're staying hydrated, you'll be getting up to go to the bathroom frequently as well. So also, because you all are my summer crew, the things you want to avoid are water slides and roller coasters. And that's it for you. All right, last thing, COVID-19 updates. So ACOG moved from supporting either way in terms of vaccination to strongly recommending it based on the New England Journal study of 35,000 pregnant women who were vaccinated with Moderna and Pfizer. Johnson & Johnson isn't recommended because it has an independent risk of blood clots, and so does pregnancy. So we don't want a synergistic risk of blood clots. All vaccines were approved for boosters. If you're 6 months past your Moderna or Pfizer, you can get a booster in your third trimester again to produce antibodies that will be passively sent to your baby. If you're 2 months past your Johnson & Johnson, you can get another, but not Johnson & Johnson. And so mixing and matching is okay. There's no optimal time plan for it against your flu vaccine, your RSV, or your Tdap. Again, I don't think you guys are the flu or RSV crew in terms of timing, but your Tdap, you can get them at the same at the same time because they do work differently. If you do get COVID during pregnancy, if you contract it, there are no recommendations for ivermectin, azithromycin, or Plaquenil, so we don't prescribe those. What we do recommend is zinc. We recommend vitamin D, and we recommend vitamin C and a low dose, like a baby aspirin, the 81 milligram, like a little bare chewable kitty aspirin until you're 36 weeks. If you get COVID after 36 weeks, don't start the aspirin, but start the vitamins at any time until your symptoms have resolved. At the time of diagnosis, afterward, we do start serial growth ultrasounds. The aspirin is to reduce gestational hypertension, which we found associated with COVID during pregnancy. And it does reduce it in general by 40%. And so we recommend supportive treatment at home. Remember, our website has stuff about congestion and cough and sneeze and not sneeze, but sore throat. Actually, sneeze so if you have allergy-like symptoms. So you only need to go to the hospital, though, if you're having difficulty breathing. So if you're short of breath or if you have a fever that you can't break with the recommended amount of Tylenol, less than 3 grams a day, and then, or obviously if your pulse ox, if you have a pulse ox, like if you're at the point where you think you need to check your oxygen, you should probably just go to the hospital. We are back to our regular number of visitors. So for my veteran moms who had your first baby during COVID and you're freaking out, don't worry, we're not doing all that anymore. So we're back to our 4 visitors plus your DONA certified doula. You do not have to wear masks in the room or in the hospital or in labor unless you are actively COVID positive. And even if you do have COVID when you're laboring, we don't separate you from your baby. You're given an isolate for baby to be protected from the respiratory droplets, and we give you N95 masks as well. All right, last poll question. I think this might be record time for this. What information can you find on the official Full Circle website? Can you find the birth plan template, safe medications in pregnancy, what to expect at each visit, or are you a master test taker and you know you need to read all the way to the end? Of course you are. Excellent. All of the above. This is the correct answer. Fantastic. Please, please, please remember to follow us on all the social things. We are social, so we are on the Book of Faces. We are on the Gram of Instance. We are on X, formerly known as Twitter. We're on YouTube as well. And we have a couple of series where mamas share their amazing, awesome rock star birth stories. And we know that you are going to add to that as well, because you could have chosen any place in town to write your birth story, but you chose us to help you. So you're going to author it. We're just going to turn the pages. So thank you all so much for your time today. I appreciate your participation and look forward to seeing you guys in the office real soon. Take care.